Hi, and welcome back. When we go to see a surgeon to discuss cosmetic surgery, it's easy to get caught up in the excitement, thinking about the benefits, the transformation, and the confidence boost it might bring. And that excitement is a good thing. We should focus on the potential positive outcomes. After all, if you don't believe in the benefit, what's really the point in undergoing the surgery? But what's often overlooked in these conversations are the trade-offs and the risks that come with any surgical procedure. What do we mean by trade-offs and what do we mean by risks? When we talk about risks, we mean about the things that might happen, such as infection or bleeding or scarring. These are possible but not guaranteed. And the trade-offs, on the other hand, are things that will happen. They are known consequences of surgery, and although they're not necessarily complications, they are often less desirable outcomes that patients must be willing to accept to enjoy the benefits of the procedure. Today, I'm going to focus on the trade-offs and the risks of a brachioplasty or arm lift surgery. What is a brachioplasty? A brachioplasty is a surgical procedure that removes the excess skin and fat from the upper arms, commonly referred to as treating the bat wing appearance. It's typically considered by people who have lost significant weight in a short space of time or simply have skin laxity due to aging. This may be if you are on Manjaro or one of the other weight-reducing drugs where a significant amount of weight is lost in a short period of time. The goal of the procedure is to give a slimmer, a more toned arm silhouette, both in clothing and when uncovered, and for many people, the risks and trade-offs are absolutely worth it. So what are the trade-offs of brachioplasty? Scarring is the most significant trade-off. It isn't a small hidden scar, it's typically a long scar running from the armpit to the elbow on the inner side of the arm. While it's placed strategically, when you raise your arm or wear sleeveless clothes, the scar will be visible. So if you want to silhouette in clothes, but if you want to go sleeveless, you've got to be aware that there will be a scar on the back of your arm that will be visible. And if you're prone to dark raised scars, this can be especially noticeable. And in some situations, the scars can stretch. With all scars, you may experience a numbness or altered sensation along the scars. Specifically to the brachioplasty, it can feel strange or even irritating when your clothes rub against it. So this is something that you need to take into consideration. Now, because we are operating on both sides, there will always be a degree of asymmetry. We will never be able to create a complete mirror image of your left and the right, so you need to be prepared for the fact that there will be a degree of symmetry, and this is something that you need to take into consideration. And you're probably already different now anyway. Skin textural changes. Some patients notice when excess skin is removed, it can feel tight or irregular in texture, and this is part and parcel of the surgery. Things do improve with time, but it's something that you need to be aware of. The other serious consideration is the recovery period. During the recovery period, your arm will be bandaged up from your armpit down to the elbow, and you will be limited in terms of movement. So you need to make sure that someone is at home with you in that first week to help you with your daily activities. So that trade-off needs to be taken into consideration. So now we're going to be talking about the risks. These are things that may or may not happen depending on individual healing, surgical technique, post-operative care, and your own physical state. So the first risk is infection. Infections can occur with any wound that is created, but specific to the brachioplasty, infection in the armpit where it's warm and moist has a higher risk. It's difficult to keep clean, it's difficult to maintain the dressings. Most of these infections can be treated with antibiotics, but in severe cases you may need further treatment. Scar contracture or webbing. If the scar extends into the armpit, and sometimes it can become thickened and tight, you can develop a scar contracture. In rare cases, this can lead to tightness and a web-like scar, which restricts the movement. So further treatment may need to be used to help soften this, including steroids or even further surgery. There's always a risk of bleeding either during the surgery or after the surgery, which may require some form of drainage in the operating room. There's always a risk of wound healing issues. The tension that you have on your arm, particularly on movement, can lead to wound breakdown, delayed healing, or separation of the lines. And smokers and people who are diabetic have a higher risk of this. Sometimes there is also a risk of fluid accumulation or seroma. This collection of fluid in the arm is usually not dangerous, but may require drainage or slow the recovery down. There will always be a risk of sensitivity and pain, and we've already talked about the nerve changes, but sometimes those nerves can be trapped in the skin and they can cause a neuroma, which could cause irritation that will need further treatment, either with massage or potentially further surgery. So to recap, a brachioplasty can offer great cosmetic benefits, especially those who feel self-conscious about excess skin in the upper arms. But you must go into the procedure fully aware of the guaranteed trade-offs, the scarring, possible numbness, and also the potential risks of infection, wound issues, and asymmetry. The decision to have cosmetic surgery should always be informed, balanced, and personal. If you're thinking about brachioplasty or any other cosmetic procedure and want to understand the trade-offs better, leave a comment below and let me know, and I'm happy to break down the pros and cons and realities of any procedure that you're curious about. And if you found this video helpful, don't forget to like and subscribe and share it with someone who might be undergoing or considering some form of surgery too. Take care and see you in the next one.